On the subject of clinician well-being, I think we all understand to some degree that it's a very high stress job, and especially nowadays, the burnout factor is very, very high. And I think we would like to know from you what would make the difference, what would help nurses and clinicians not to cross over that line.
For clinician well-being, it would be so important to look after the mental health of nurses, just like we need to look after the mental health of others, but nurses in particular, as we work 12-hour shifts and we're there with our patients, even though it's a 12-hour shift, we're there with our patient on a 24-hour basis. We need to know everything about those patients. Now I'm talking about hospitals, but even in community, public health, we're trying to make sure that people don't go into hospital, that there's no reason for them to go. And so we are the people, I always call us the glue that holds everything together for patients and for the caring that they need. In addition to caring, also making sure that they have incredible opportunities for the best life possible. And nurses need that too. One of my colleagues, she used to say that she did go straight home. She would take the long way home in her car to make sure she had time to change from one very stressful environment into another very stressful environment, and be there and able to give to her family all of herself. So we are always looking at what those issues are. I would also just ask that there's more mental health support, that there's more equipment if nurses need equipment, that there's more staffing if nurses need staffing. We are like I said, we are the people who need to make it work, the whole system work.